Well, it's time for us to get some health and safety tips now. Here are some things that you need to know about skin cancer prevention. Manolo has more in today's Catching the Wave to Better Health with UHA.
Well, it is that time of the year, longer days, a lot of people out and about spending their day out in the sun. Certainly they could use a few words of advice and warning about skin cancer. Howard Lee, the president and CEO of UHA, as well as Dr. Carla Nip-Sakamoto, a dermatologist. Good morning to both of you.
Morning.
Howard, we'll start with you because certainly you know all about this particular problem, and certainly prevention is what we want to hit upon.
Well, we have actually the expert here, which is Dr. Carla Nip, but all I wanted to say that at UHA we believe in prevention. And you know, one thing about skin cancer is it's something that may occur later in life. So a lot of the things that we do now and the decisions we make may not affect us. And you know, I remember when I was young, a long time ago, you know, we never thought about
that long ago.
Well, it's a while back, but we never thought about, you know, putting on sunscreen and be out there surfing all day. And you know, I had a personal experience where just maybe 6 or 12 months ago, I had, you know, some things on my back that an observant doctor saw, and he did a test, and luckily it was benign. Yeah. But I think back at, geez, when I was young, maybe if I was a little smarter, I should have put on some sunscreen. Yeah. So we just wanted to bring attention to this important issue.
Well, doctor, we know a lot more now than we did back then, and certainly if we can sort of prevent a lot of it by knowing what you can tell us here.
Yes, I think prevention is the key. I mean, we really don't want to get to the point where we have to treat these lesions. We want to try to prevent them.
What can people do to prevent, and just really just smart things to do when they're out there?
Well, I think probably the most important thing is to protect your skin by covering up. And I have an attire here that is a sun protective jacket. It's got a UPF rating of 50. UPF means ultraviolet protection factor, much like your SPF factor in a sunscreen. Okay. And it's important to be long sleeved, as you have, nearly long. If you can't get clothing on, the next best thing is sunscreen. And I think the problem really with sunscreen is, we were talking about Howard earlier, is that a lot of us just don't put on enough.
Yeah.
And
what is enough?
Well, the recommendation is to put on about an ounce or 1 ounce of sunscreen over the adult body that's in a bathing suit. So that's
1 ounce is quite a bit. You have a little tube you want to show us?
So this Manolo is an ounce.
So this is quite a bit. You should actually apply all of this.
All of it in one application. You can see why it's really difficult. So what I recommend actually my patients do is to put layers on. So to put one layer on, wait about 10 minutes, and then put another layer on, because it's really hard to rub all that in at one time. Okay. For those of you who want something that's sort of out of your cupboard, this would be equivalent to a shot glass, and that, you know, is a lot of material.
Be generous and then lather it on, okay? I know, and one of the things, there's a whole thing about SPF. Now you can go 30, 40, 50, 100. I mean, is there a difference? Where do you start with that?
Well, we recommend a 30. You know, a 30 will block out about 97% of the harmful rays. If you go above that, a 50 will block out 98%, which doesn't give you that much coverage, especially in Hawaii.
Especially, yeah, our sun is very strong. Okay, things to know, especially with summer coming right up. Thank you. I'll give you your spec. You'll probably need that later on. Okay, we'll be right back with more with Wake Up Today.